name is Lynn Alexandrowitz, and we are here today to present all different options for you. Navigating the Healthcare Highway is the title of our program, and we're going to present from the PACE program. What is a PACE program? Fallon Summit is represented. Eileen is representing. I'm representing two companies. I'm representing Accessible Home Care, which is a private home care agency, as well as Shrewsbury Nursing Center, which is a family-owned nursing home in Shrewsbury, servicing clients from this area also. And then we also have Melissa Badario from Orchard Grove Assisted Living in Shrewsbury, and she's going to talk about options in assisted living. And then we have Notre Dame Hospice. Patty Tebow is going to talk about what hospice is, what palliative care is, what's the difference type thing. And then any of you have questions, feel free. So we're going to all take turns presenting and kind of give you a quick overview so you have a little more knowledge when life changes and you need to make a decision. And all of a sudden you find yourself, if you fell and you fractured your hip and all of a sudden you're in the hospital and they said you need surgery, and then you leave the hospital and they say you need to go for short-term rehab. What does that all mean? So we're going to kind of explain the options out there. So, and we're all local, which is nice. So when you have a beautiful senior center here, and it's always well attended. So we thank you for your time today. And we have a bunch of brochures and some giveaways and handouts. So feel free to gather those before you leave today. So I'm going to start, and we're all going to talk for about 10 minutes each. I have my little clock here. So again, my name is Lynn Alexandrowitz. I actually live in Millbury, and I've been in the healthcare field for about 40 years now, so a long time, in all different avenues of the healthcare. So we have a lot of resources at this table today, which is nice. So again, thank you for having us. So I'm going to talk about what home care is. So home care basically is two different divisions of home care. One is Medicare certified home care, which is, a lot of you will know the term VNA. You've heard the term VNA. That's a Medicare certified home care agency. And that is paid for by your insurance. So paid for by Medicare or Medicaid, or maybe Fallon Senior Plan, or what else you have for managed care, maybe a Blue Cross managed care program, or what have you, for a product that you may have for insurances. And that will come in and they'll, let's say, we'll use the scenario. You fell, you broke your hip, you went to the hospital, they did surgery. You are going home, you think you're going home, but you're not, and they say, we need you to go and have some rehab done, short-term rehab. So they call it like short-term was the term they will use. And that means you'll probably go to a nursing home or nursing center or rehab center. They're all the same name. And you'll go there probably for about 2 to 3 weeks, depending on, you know, the severity of your surgery and the break that occurred. So you go, you do short-term rehab there, so you'll have nursing, physical therapy, you'll have rehab, OT, PT, that is the term that would be used. And then they're going to send you home, and you would go home with home care. So you could either go home with VNA home care, and they'll come in and they'll do maybe 2 weeks worth of coverage for you. So they'll come in, they'll send a physical therapist at your house, and they'll come in 2 or 3 days a week, maybe an hour each time, 45 minutes to an hour usually, and they'll do physical therapy with you. They may send an occupational therapist out too, and that person would help you like maneuver. Let's say you, again, broke your hip and you're using a walker, but now you're in your kitchen and you're trying to maneuver through your kitchen. So an occupational therapist would help you and show you how to maneuver through your kitchen and reach and bend and do things that you normally would do, but now you're using a walker. And they will be in for a couple weeks, and then if you needed the other version of home care is private home care, which is what I represent today, Accessible Home Care. We're located in Auburn, Mass. We service this marketplace, and we're co-owned by a nurse, which is really nice. So private home care means that you pay privately for those funds. So insurance does not cover your home care, but we can come in and help you with, have you all heard the term ADLs, Activities of Daily Living? So that means that we would come in and help you with your bathing, your toileting, and your dressing. So getting dressed in the morning or in the evening, With private home care, it runs the gamut. You can go from a minimum of 4 hours of coverage of someone coming into your house to having someone live there with you, so what they call a live-in. Or let's say someone else needs more clinical and they need someone living there or 24/7 care. That is what a private home care can do. Usually private home care, again, does not accept insurances. They do accept long-term care insurance. Do any of you have long-term care insurance? Mm-hmm. Okay, so depending on what policy you have, what your premium was, how long you bought it for, it may cover for home care, it could cover for assisted living, it could cover some hospitalization or nursing home care. So the difference again with your home care agencies or Medicare certified agencies or VNAs, and they take insurances, or private home care, and there's no short term. You can go a minimum of 4 hours once a week to 4 hours once a week for the 52 weeks. So it can continue, it's your choice, and that can be with a certified home health aide as well as a certified nursing assistant, and they will come in. And we, as accessible as we are co-owned by a nurse, so we are overseen by our RNs, oversee your care, which is nice. Up on the table, I left a flyer, and this is from the Home Care Alliance Coalition, which is in Massachusetts, and it tells the difference between what a certified nursing assistant is, what a companion care person would be, what a CNA, what a home health aide is, and their schooling that's required, their certification that's required. So it's a nice little handout to have also. And I'm going to now turn this over to Eileen, who's going to talk about what the PACE program is, and she'll be talking about Summit Fallon. Do any of you have any questions regarding home care right now? Okay.
Very expensive.
You can hold your questions to the end, or feel free to ask us while we're all speaking. So I'm going to turn this over to Eileen Rice now, who represents Fallon Summit PACE program.
Hi everybody, again, I'm Eileen, and I am from Summit Care, which is a PACE program. The PACE program is all-inclusive care. Summit Care has 5 different locations in Massachusetts, so the closest one to here would be, well actually, either Webster or Worcester, depending on where you're located. We also have a location in Leominster, in Lowell, and in Springfield, and then we have a location in New York as well. So I will explain a little bit about the PACE program. So what we do is we provide care for people to remain in their home independently, or with services, I should say, but be able to safely remain in their home. So it's an alternative to nursing home care. So and we're supported by both centers of Medicare and Medicaid, as well as what's called the state administrative agencies, which is the Executive Office of Elder Affairs. So that's how our program is supported. So who can join our program? So the PACE program is anyone that's 55 or over, and you live in our PACE service area. So we have a service area which we've actually just recently expanded. Previously, we were 25 miles from our physical location, our site. We're now 35 miles from that location. So we have expanded. And as Lynn had mentioned before, we also look at like ADLs, assistance with daily living. So that's sort of how we determine, so someone being nursing home level of care, but remaining in their home. So basically you have a certain number of ADLs, assistance with daily living. And that you can live safely in the community with the assistance of services from us. So how does PACE work? We have your primary care physician becomes the primary care physician at the site that you're affiliated with or associated with. So you have that primary care who is your gatekeeper, and they are coordinating your care and your services. We do have specialists that are within the community that we work directly with. But the model of care, so our care team consists of, we have, as I mentioned, the primary care physician. We have nurses, social workers, physical therapists, occupational therapy, dietitians. We have our PACE center manager, home care coordinator, personal care attendants, and transportation staff. Because at the site, so we provide services in the home as well as at the site. So if you were to attend the site, we have, along with the day program, There we have physical therapy, occupational therapy. Those services are also available. So our day program is open 8 to 5, Monday through Friday, and transportation is included with that particular program to and from. So people qualify differently as far as the, if you're qualifying through Mass Health, or if there's a shared cost, or if there's a private pay cost. That's all determined by your income. So that's something that the representative will discuss regarding the PACE program.
And Eileen, if somebody was to go there, would someone come to their house to help them in the morning? How does, like a day, let's say you have a relative that wants to go to the PACE program in Worcester. Can you explain from the morning time to the end of the day what occurs?
Absolutely. So what happens is, and as part of the program, as part of the process is the initial intake where the information's taken and you begin the process, and you have a nurse that would actually come out and meet, complete your assessment to make sure that you clinically qualify for the program. And then the next step is where you have a nurse and the social worker who's going to meet to determine what that care plan is. So once that care plan is determined, as far as what the needs are for the participant, whether it be 2 days of adult day health with transportation, and if they need assistance in the home prior to, that's all determined by the care team as what those services are.
So the aide would come in the morning and help them get ready?
If that's, so basically what's determined by the team as what's necessary, those are the services that they've worked with the family to establish.
And they would have socialization as well as meals also?
Meals, they have absolutely, they have a hot lunch every day of the program, and you're absolutely right, the socialization is the key, it really is. So, with the staff, the activities that are on every day, so.
And they kind of act as the gatekeeper, so they would use your physician versus going to another primary care provider.
Yeah. And the best part is too, so our physicians, our primary care physician, and our staff, they specialize in geriatric care. So, as that gatekeeper and that person coordinating the care, they're all very familiar with, obviously, geriatric care, so, which is their specialty, which is great.
Have you all heard of the PACE program and the summit? Do you know anybody that attends at all? So as Eileen mentioned, there's one in Webster, which is fairly new, it's beautiful, and and just everything there, as well as a few in the Worcester marketplace too.
Yeah.
So it's a great program if you are a caretaker or thinking of your future if things change and you're thinking of what options I have available. It's a nice resource to start versus, you're still staying at your home, but then you can, go there, and again, you can go 1 day or 5 days a week. It's not open on the weekends, correct?
It's not open on the weekends, and you're absolutely right, Lynn. It is more, some people may join the program and, they may not want, at that particular point, not want to attend the program. But if they decide at a later date, they can, as far as that's why they're working with the social worker to work on the services or establish the services that are needed. And if you choose not to attend the day program, there's also services that are available in the home.
And could you talk a little bit, Eileen, about the adult waiver, the waiver that is involved with the state?
Oh, the PACE waiver?
Yes.
So as far as, I'm sorry, yep. So absolutely, so if you're applying, so if you qualify for Mass Health, where they look at your income and they say, it's Mass Health with the PACE waiver, your monthly gross income cannot exceed $2,742. So that's how they look at it. So, and again, this is with the PACE waiver, and your assets can't exceed $2,000. But if you do qualify for the Mass Health PACE waiver, your services, what you're receiving is covered at no cost. So your prescriptions, so as part of the program, your prescriptions, your co-pays, your transportation, all the care that you're receiving are, that's set up for you. So,
Questions that you may have for Eileen, anyone? This is a quiet group.
and the thing is too, like Lynn said, honestly, it may not be something for you, but you may have a friend or a family member that may be in need of services that you can think of. So,
when you say you can go there, does that include just like like a daycare where they're not necessarily partaking in the physical therapy, whatever, but you can just drop someone off to be.
So that's a great question. So what it is, there are definitely day programs, adult day health programs that are separate. With our particular program, you would have to be enrolled in the program because it's the all-inclusive care, but that is one of the options. So if the participant is attending the day program, they would either have their transportation through us, or if somebody was bringing them, and they would attend the program during the day, and then they would go home at nighttime. Yep, and they'd be there.
It has to be all day, can it be broken up? And
I would say that's something, so I would definitely, you'd have that social worker to work, if somebody,
program.
exactly, so if somebody would prefer maybe a little bit later, or maybe not to go for the entire 8 hours, absolutely, that would be a conversation that you'd have to determine what is best for that participant, definitely.
What's nice too is if you are a caretaker, you know that your loved one's going to be in a safe environment.
Exactly.
And that gives you a day to either, if you're still working, or, you need respite. Again, we're representing all different options out there, which is nice. We're lucky that we live in the state that has so many options to offer.
That's true.
Which is nice, so.
Absolutely. So everyone's benefiting, the caretaker as well, the caregiver, I should say, as well as the participant. So, any other questions? I do have lots of information here and some giveaways, so please feel free.
Great. Thank you, and Eileen has her cards also, so if you have any questions afterwards, we all have our cards. You feel free to give us a call. And we try to be resources for you, so if we don't have the answer, we will find someone that does. We know a lot of people, so I'll use the term Rolodex. Everybody still knows what a Rolodex is. Generation X has no idea. But Rolodex, so we all have like a Rolodex of resources that we can call and say, listen, we have, such and such is interested in this. Is there something you could reach out to speak with them? So we would absolutely be resources for you in the future also. And working with Michelle too. Michelle has all the contact information too. So now we're going to move on to nursing centers. So we call them nursing homes, nursing rehab centers, all the terminology that's out there. So a lot of you are familiar with the nursing homes of years ago, where you basically went there and you stayed there and passed on in life. Well, they've come a long way. They've changed. There's about 300, there used to be 400 something nursing homes in the state of Massachusetts. There's about 375 nursing homes now. And most of them are corporately owned, so they're owned by corporations based in New Jersey and New York. There's a few local nursing centers that are still family owned. I represent Shrewsbury Nursing Center in Shrewsbury. It's been around for 70 years. And it's on Julio Drive in Shrewsbury. If any of you remember Julio's Supermarket, it's where that used to be, but behind there. So we are family owned, and which is nice. So we're run by local. We have a board of directors, and we're run by local people. And a local family still owns us, which is nice. And our nursing home is a smaller caliber. We have great staffing. We have nurses. We have physical therapy. We have occupational therapy. We have aides. We have social workers. We have case managers. We're Medicare and Medicaid, so we accept insurances. And we'll use the scenario again. Let's say you broke your hip, you went to the hospital, they said you need to go for rehab. You would go to a nursing center, and I want to back up a minute. You all have options, and when you're in a hospital setting, you have a case manager and a social worker that you work with. And they may say, because they are so inundated and they have so many clients on a daily basis, they may say, okay, you're going to go to the ABC Nursing Center. And you can say, you have an option, you say, no, I'm going to go to the XYZ Nursing Center. So you can kind of dictate of which nursing center you would like to go to. All of them usually accept most of the insurances, so that's usually not a problem. And the years ago of, they have a wait list, that's not what is happening these days. So most of the nursing centers don't have a wait list. So you would go in for short-term rehab. So you'd probably be there maybe 2.5 weeks, and you receive physical therapy, occupational therapy, nursing. From days 0 to 20, your Medicare covers it at 100%. From days 21 to 100, there's a copay charge. So let's say you have straight Medicare and you have no other backup insurance, you just have Medicare. You would have to pay that copay charge every day. And it's about $200-something a day right now. But let's say you had Medicare and you had Medicaid, or you had Medicare and you had another insurance. Let's say someone worked in the postal department and you had insurance through the post office or whatever. That secondary insurance usually pays the copay charge from day 21 to 100. So again, usually short term, you're there probably 21 days, if that. And that would encompass all your nursing care, your meds, your medical director of the nursing center would oversee your care, your physical therapy, your occupational therapy. A lot of nursing homes have short-term beds, which Shrewsbury does, as well as long-term. So when the decision is made for that loved one that you're caring for, and they may need really around-the-clock care, and you may have tried maybe, going through home care, maybe the PACE program, and at this point in time, you need to make a decision. When you go, nice little. When you go in, I always say, and Melissa brought this up the other day, to maybe choose like 3 nursing centers to go look at. To really see, what they're about. Don't look at the chandeliers and the carpeting. You want to look at what the staffing ratio is. You want to look at what they had on their state survey. So state survey also has a STAR program associated. So you have a star of like 1 to 5. 1 is not the best star. 1 is the worst star, okay? 5 is the best star. So you can go on, even look online and look how the nursing homes have a star rating. 5 is the best star rating. So you can also, I would say, go in, look, don't make an appointment, walk in unannounced, ask for a tour, look around, ask particular questions. I have a nursing guide right here, and this is over on the table, and this is great. It has a list of questions to ask. It also, in the back page, has a resource for all questions regarding, if you're looking at the Massachusetts Senior Care Association, they are the overseers of the nursing homes. So you have direct questions, you can call them also. So this is a great guide to have and keep on hand. So a lot of the nursing homes, again, have short-term care. They also have long-term care that we just spoke about. And a lot of them have memory care. So memory care means that it's a secured, usually it's a secured unit made up sometimes of anywhere from 10 to 25 apartments or beds. And it would be for someone that's been diagnosed with dementia or Alzheimer's. And that unit is really geared towards that disease, so they have a different ratio of staffing. The colors are usually different, paint colors and the noise level and the activities. They have a lot more activities going on than regularly in the nursing center because it's geared towards the dementia and Alzheimer's clients. So again, that's something to think of. We all think that we can take care of our loved ones, but sometimes with Alzheimer's it's very, very difficult, and you have to make that decision. But again, it's for that person's care, safety, as well as you as the caregiver. Because if something happens to you and you end up in the hospital and you're the caregiver, what happens to that person that you're taking care of? You have to really kind of plan ahead and have some resources in place, because life, as we know, happens and can change in a minute. So, so look at the nursing homes. Go to 3 different ones. Again, if you're in the hospital yourself and they say you go to the ABC, you can say, I want to go to the XYZ nursing centers. So very important. Questions that you may have about nursing homes? No? Okay. All right. So we're going to move on, and we're going to go to assisted living. It's another option that you have. And this is Melissa Badario from Orchard Grove Assisted Living in Shrewsbury.
So my name is Melissa. I've been doing this for about 10 years. Spent many a days on the soccer field right across the way with my kids, so I feel like I am back at home or down at Soldiers Field with baseball. And I represent the residents at Orchard Grove. We are an enhanced, independent, assisted, and a memory care living community. What we are not a place that's going to take things away from you, but rather we want to help you make things easier when life becomes more difficult to manage. When maybe you don't fall into the PACE program or you're not ready for that nursing home, and life is becoming harder in the home. So we offer independent, we offer assisted, and we offer memory care. So you can continue to live your life the way that you want to, but not have to worry about such things as cleaning, yay, laundry, cooking meals, or maybe planning that trip, or having lunch with friends. It's great what you're doing right now, right? You enjoy being around people. But there may come a time where your friends now move away. People pass, you're not driving, and your life now in your home becomes smaller, and you're missing that engagement, that social piece, having a meal with friends, having happy hour at 3 o'clock, watching a movie with somebody. So not only can we support your needs if you need something physically, maybe help with showers or dressing or taking you places, but we can also give you that social piece that as we get older and life changes, we can bring that to you. We are a community about choice, so you don't move in and people are going to tell you breakfast is at 8, lunch is at 12, and dinner is at 5. We have a beautiful restaurant. It's open from 7 a.m. to 7 p.m. So if you want to come down at 10:30 and have a full breakfast, have coffee at 3, and then a dinner at 5, you can do that. It's really about keeping you socialized, keeping you with friends, having great times, and supporting you wherever your life takes you. We are located in Shrewsbury. We are the newer kid on the block. We've been open for about 5 years. And I will say that we have a wonderful group of residents. We're a little under 100 people, and they are definitely residents that want to live life. You know, life doesn't stop at 65. Life continues at 70, 80, 90. I have 96-year-olds that probably could beat me around the walking path. You know, it's unbelievable. So we're really about living life to your fullest when staying at home is not really the option. We all want to stay at home for as long as we can, but life is meant to be with people and living. And at some point, you might not want to cook. You might not want to shovel that walkway. You might not be driving. So we can keep your life the way it is now, but make it easier. So when things get harder to manage, we're there to make it simpler for you. So I did leave you some brochures. I don't think that you're all looking for me right now, but when you don't fall into the PACE program, when you're not ready for that next level of care for nursing home, we're kind of that in-between where we can help you get the support you need, have great friends, have great times, and keep you feeling like yourself. So that's what we do.
Can you tell me about the finances? So is there a monthly charge or?
So we are, so when you start to look at independent and assisted livings, there are 2 different models. There are your buy-in models, where you're paying, you know, hundreds and thousands of dollars to enter in. And then there are your lease agreements where it's month to month. You pay a community fee, which is usually anywhere from like $4,500 to maybe $6,500. You pay that one time. And then it's a month-to-month lease. So you are not locking yourself into something for a year, 2 years, 5 years. If you come in and you don't like it 6 months later, or all your friends are moving to Florida and you're going, it's just a 30-day notice. Your buy-ins are a little different, where you pay that big entrance fee and then you get it back once they sell your apartment. So for us, it's a little bit easier. It's a lot less money out of your pocket. I always say if you have that much money to give to someone, if you put it in the right account, you could probably make enough money with interest to pay me for at least 7 to 8 months. Not that I'm that great, but when you do the figures, it works. So we are all private pay. So it's a great way when you have those assets before you're ready for, that will keep you from mass health, from that, you can spend it down with us and use that to pay for your care.
What about meals? You know, how do meals come in? That would be extra?
Nope, meals are all included.
In
So
your rent, in your...
Yep, so in your rent, we're gonna clean your apartment. We're gonna take out your trash. We're gonna make your bed. We're gonna change your bed sheets. All of your meals are included. We can provide transportation. If you wanna bring your car, you can bring your car. And all of our engagements are included. What would be extra when you go to the hairdresser, and if you have phone and cable in your room. And we are very well known for our food. Food is very high
Fabulous.
quality, it's fabulous. Before I came to the residence at Orchard Grove, I worked in another community, and I would bring my lunch every day. And I've not brought my lunch ever. So it's phenomenal. We have 2 specials every day, and then we have an always available menu of grilled shrimp, fillets, and you can customize the food plan as you want it. So it's really, when people think about it, I say don't think about it as assisted living or independent. It's a senior living community. It's your peer group that have moved in and don't want to do those things anymore. They've been doing it for their families, their kids, their loved ones, for their whole lives, and now it's time for you. So to try something new, maybe take up the art class that we offer, or you're going to go, to this museum where we have this fabulous ballroom dancer that comes in. You're going to try something that you've always wanted to try, but you didn't have a chance to when you were raising your families or working and all of that. I did learn how to foxtrot. I never learned how to do that, but I did.
And you just had a speaker too, right?
And we just had a
Marathon.
wonderful speaker about the Boston Marathon. He wrote a book, and he came in. So we're about learning something new as well. And we have people from all over that come to us. But that is all included. So, and it is very good. If you ever are in the area, please stop in. You're always welcome to have a meal. I always encourage that because food is, it's super important. You want to make sure that it's good. So you're always welcome to come in.
And don't you also have home health aides there?
We do. So we have nursing on staff till 7 o'clock at night. We have home health aides. We have CNAs. We have PCAs. In addition, I also have some residents that may utilize Lynn. They come in. I have a resident that maybe needs help getting on and off the van, so I may have Lynn's group come in. We also send residents that need short-term OT and PT over to Shrewsbury Nursing and Rehab. So we do partner heavily with partners in the community. And then if somebody really, if they've stayed with us and now they're at the end of life, that's become their home. And we do love Patty and Notre Dame. So we really, we try to keep it close with each other, people that are good with our residents, our families. And that's something, if you ever have a question, ask people that you know. Call somebody. We're always going to help you because you do have choices out there, lots of them.
Great. Any questions that you might have for Melissa?
What kind of amenities are in the building for the residents?
So we have a main library, which is downstairs, complete with fireplace. We have a pub. We have a bistro upstairs on our 2nd floor. So in addition to the dining room, 3 days a week, our chefs will prepare a meal in front of you, whether it's paninis or a stir fry, so you can eat upstairs in the bistro, which is a pub. We have an art room. We have a hairdresser. We have free laundry rooms. If you didn't want us to do the laundry, we have those. We also have an exercise room on the 3rd floor. We do exercise classes twice a day, from stretch and strength. We do bar and balance, seated yoga, tai chi, and cardio drumming. In addition, we partner with the Shrewsbury Senior Center. So if our van is out busy and you need to get somewhere, the Senior Center van will take you. I have a gentleman that still goes to Worcester Fitness 3 days a week, so we take him down there. We have residents to go up to the Shrewsbury Athletic Club, which is right next door. So those are, and we have a walking path and a beautiful outdoor patio with a fire pit out there. We do a lot of events out there. So we're really big into outside and gardening and flowers. So whatever your hobby is, I am sure that we have it. And bird watching, that's our latest thing. So.
Any other questions that you might have for Melissa? At this point in time, I'm going to bring it over to Notre Dame Hospice, and Patty Tebow will represent and talk about what hospice is and then what palliative is, but palliative care, because a lot of people are confused with the 2 different terminologies. So Patty will be able to be a resource and let us know how that works.
Thank you very much. Thanks for having us again. We really appreciate your attention and your time. And I want to say, before I even get into Notre Dame specifically, I have worked with all of these programs. I have been in this Worcester community for the last 7 going on 8 years. And when I say Worcester, it's not just Worcester. It's this whole central Mass area. And I'm not from here originally. I worked in Boston. I grew up in New Jersey. I say this is like the biggest, smallest town. It's like, there's so many little pockets, and we do, in this area, have a lot of resources. Massachusetts is a phenomenal state.
To age
The
it.
elder services, just the things that are in place. Sometimes the problem is you don't know what to ask. You don't know what you just know, oh my gosh, whatever has happened has happened. So again, even if it doesn't make sense to call somebody that you've maybe had a card or a pamphlet, I can say even competitors, for the most part, everybody who works in this community, serving your communities, they care. And they truly try to put themselves in your shoes and offer out what they can and get you to someone who maybe can answer questions better. But I do tell you, it's a great place to be as a senior. And I tell my husband, I live in Connecticut, that there's absolutely no way we're retiring. We're coming up here. So, I mean, if we get to retire, kids, college, all that. So, but it's a great area, and all of these places that you've heard about today are phenomenal, and a lot of caring people. As hospice, as palliative care, it's an at-home program. So we go to you. We go where you live. Where you live could be an assisted living. It could be a memory care unit. It could be independent. But that's where you live. That's your home. So we're going to go there. We're working for you, not for the assisted living, not for the independent. So that's something to keep in mind. The at-home program, our hospice, we go to where you live. If that were Shrewsbury Nursing Home, we would go to Shrewsbury Nursing Home. Again, that's your home, and we're working for you, so we will go there. It's important to really know, everybody has said this, choice. Choice, choice, choice. I was floored when I first came to hospice. I have not was with hospice. Came in and started learning, and just fell in love with Notre Dame as a nonprofit, mission-based, patient-centered, local, community-serving hospice. So no corporate offices. We still have sisters from Notre Dame, Dina Muir, sitting on our board. We're still serving the community that we live in. And what I was shocked about, though, is that you're in a situation like these ladies have mentioned. You go to the hospital, you find out something, or a loved one, and you're faced with this decision, and they tell you, okay, we're going to send you home on hospice, here you go. Well, like, you should know what that all means and what it's going to take care of that person. And would we redo a kitchen, or have someone in our home to redo any one of the rooms in our home without ever having looked at their website or their brochure, or talked to a friend or a neighbor? Have you ever heard of this guy, And it's like with hospice, we're not doing that because we're so afraid of the word, and we're in such crisis sometimes, or maybe not even crisis, maybe it's a diagnosis that we've heard about, but we're afraid of it, so we really don't want to talk about it because it's very, very scary. And you're doing yourself a disservice, because you can't always change an outcome of a diagnosis, but what you can change and control is how it all plays out for both the person with this diagnosis and for you as a family, for you as loved ones. You can really affect that. So what is hospice? What do we do when we get there? Somebody goes home on hospice. If you're lucky and you get to take them home, that's awesome, and you are going to get nursing care, but they're going to come in 2 to 3 times a week for an hour. They're going to work on making sure symptoms are managed well, and that there's no crisis, there's no acute things happening where you're wanting to kind of knee-jerk call 911. We want you comfortable. So that's the nurse's job as the team lead. Get you comfortable. What goes with that? Then you get social work. They come in and they really help you with conversations, and to their point, I've heard this mentioned today, plan A, plan B, plan C. It doesn't mean you're going to have to make those decisions, but wouldn't it be nice if somebody who knew the things that could happen educated you on that? So at least you get a little bit of like, okay, if this happens, we're gonna do that. If this happens, I don't want it to happen, but you know what, worst comes to worst, here's what we're gonna do. You know, and then, worst case scenario, here's what we're gonna do. And you hope you never get there, but there's a lot more control given back to you by being educated on what your choices are. Home health aide, they will come in based on what the need is. So if you have somebody who really needs somebody to come in every day to help with care, they're going to come in every day. That's typically for somebody who really is truly needing a lot of assistance. Most of our patients, though, home patients, 2 to 3 times a week, and they're going in to provide a shower, change the bedding, make sure that somebody, you know, is clean and groomed, and it gives the caregivers can start to become the wife again, the daughter again, the son again, the cousin, the neighbor, the best friend, what have you. And we can become some of the caregiving. So now our nurse is worrying about the medicines and putting the schedule in place. The social workers helping you to have conversations and put some plans in place. Home health aide now is coming in and helping you with some of the work, you know, some of the heavy lifting. On top of that, we have volunteer programs. So we try to match up. We have this one, it's a veteran program. It's called We Honor Veterans, that we work with the VA and the National Hospice Federation to earn this. And part of what we have to do to earn this is to make sure that we have veteran volunteers that can go and sit with other veterans for end-of-life review, because a lot of times they're not really wanting to talk to just anybody about things, but there's things, right? They've been through things and they want to talk about it, or just to have someone understand their life and do a little bit of review and talk about what it was like. Even if somebody has dementia or Alzheimer's, sometimes they've traveled back into that time of their life, and it's really important to have someone who can understand what that looks like, so that they feel, because even with dementia, you still have feelings, and you can feel supported.
Patty,
We also,
what is the criteria for getting on hospice? What would be the
so
criteria?
it's terminal diagnosis. However, terminal means a lot of different things. You know, everyone thought, well, you have to have cancer, and you have to be, you know, really right at the end. That's not going to provide a lot of support for you. So it's heart disease, end stage, COPD, end stage. It's, like I said, Alzheimer's, end stage. Most of the stuff, end stage. So what does that mean? It means that you've gotten to a place where your doctor's saying, you know what, that blood transfusion or those treatments you're coming in for, the dialysis that you're getting, all of this stuff is really not changing anything anymore. And you're having more and more weakness, you're having more pain. We just really want you well managed, and we want you to enjoy and you say, oh God, enjoy. How could you be on hospice and enjoy anything? Not the case, you know, because if you like I said, the volunteers, you've got music therapy, you've got massage therapy. People can come into your home and give you some quality. You're getting that socialization. Again, that human touch is so important, so you're not isolated. They can, you know, read books with you, read a book to you, they play cards. You know, we've got a guy who loves to play cribbage. We had one who played the trombone. So one of our volunteers, who knew? He plays the trombone. So they would get together and play the trombone. Not every end stage, end of life is in a hospital bed, doom and gloom. You know, you may end up in that hospital bed, you know, but if you really want to try to have some good quality time, the weather's beautiful, you want to do bird watching, our goal is to make sure you're free of pain enough and able to maybe have the aide take you outside to the deck so you can do that. And then the caregiver gets a little break. If you don't have a lot of caregivers and you want to take someone home, there are private pay agencies that are capable of taking care of patients at that level.
How is it paid for? How is
hospice
paid for?
is it's under your Social Security benefit, so it's Medicare. If for some reason you don't have Medicare, you work for the state, insurance agencies all pay for for this full out, no co-pays, you know, unless we have run into a couple for like younger folks who have a different kind of insurance. And then Medicaid, Mass Health will pick that up if all else fails. We've got, a great net here. So all of these things are included. You will sometimes be told, when you're talking to doctors, you'll hear your loved ones that have been, maybe they heard something, palliative care. Palliative care, it's not as scary of a word as hospice. They are interchangeable. They both mean comfort. But the healthcare system is very fragmented. As you know, if you have more than one doctor, if you've got a pulmonologist and a cardiologist and you got a little diabetes, you go to see someone for that. A podiatrist, you've got your dentist. It's very difficult to keep up with all that. So what we've noticed, what insurance is, Medicare, Medicaid, hospitals, everybody knows, because of the fragmentation, not everybody's communicating with everybody else, and so you're not always getting the full picture about a patient or about a person's care. And so things are getting missed. And so somebody might be, kind of going downhill, when in fact, if there was enough communication and wraparound services, maybe we could figure this out and get you stabilized, and you're really not as doom and gloom as you thought. So that's where they're coming up, they're trying to figure out ways to pay for palliative care, which is before hospice or instead of. You could get a hospice diagnosis and say, I'm getting chemo, I'm fighting this thing. And you should be allowed to without them saying, well, there's no services now. So palliative care can come in and find out, does PACE have a service that would fit adult day help? Or does LINS, or should I go to the nursing? Like, there's all kinds of things that you can do, but you need someone who's in the know, because you don't even know what to ask. And so if you have someone in the know who really understands the industry in healthcare, but the thing about MPs and palliative, at least our program, is they come and sit in your house at your kitchen table with anyone that you want at the table. And they don't tell you what to do. They ask you what you think you would like. Okay, what's going on? What are your goals? You want to stay home forever? You want to never go on hospice? Or is that a possibility if things don't work out, but you want to fight right now, but it's hard because I don't have, and this is going on? They get in there and they start looking at everything, and then they go back and try to get a game plan together. And then they try to help get you onto that game plan, that care plan, and see if we can't make a difference and steady things out for you while you have time to think and process about this new diagnosis that is scary. So they are coming up with that, again, Medicaid, private insurances, Blue Cross. You would have to go, when you hear and see palliative at different agencies, just FYI, go on their website, call up, find out what does it actually include, because unlike hospice, there is not a standard. Medicare doesn't say, it's not a standard. We're all figuring it out right now. It's kind of the Wild West. But it's really, really important that we start doing things for people in between. Hey, living my life, some aches and pains. Hey, got a terminal diagnosis, and who's in between? So we're trying to figure this out. Our healthcare system absolutely needs this. We have to keep people out of our ERs because, as you know, if you get stuck in an ER or a walk-in clinic, you're there for the day or two before you even get your tests. So our job is to keep that from happening, keep you out of crisis, educate you. The more you know, even if it's stuff you don't want to hear, the more you know, you can make really good quality decisions. And you can talk to your family about it and get input instead of just, oh my God, I'm in the hospital and they told me I have to do this. Boom.
Right. Again, you have options.
Yeah.
You can, speak for yourself, or do any of you have healthcare proxies, Michael? Okay. So make sure that you have a healthcare proxy, so if you cannot speak for yourself, if something happens and you cannot speak for yourself, that person that you designated as your primary healthcare proxy can help and make the decisions that you wanted to be able to make for yourself.
And that person is on board with what you're asking them to do.
Right.
I work with a lot of families, and, especially if, hey, the son's the doctor and he's the oldest and he always made the decisions and he's the healthcare proxy. Well, he is not gonna put you on hospice, right? Or something like that, so you really wanna kind of think about who did I designate? And even talk with them, say, are you okay with this? And some will say, Mom, Dad, don't ask me, I don't wanna do that. So not everybody feels comfortable with that, and so it's okay.
And aren't they doing in med school now, when they're doing their training, they're actually teaching in the courses, they're teaching them about hospice, These are your options.
just, by the way. So you will not need a doctor that knows about it, and that's not an insult to a doctor. Right up until very, very recently, curriculums had absolutely nothing about death except pronouncement, and the disease process. There really wasn't any focus on that, because a doctor is bred, to save, to fix, to make it better. And so it's very difficult for a doctor to look you in the eye, especially if he's been your doctor for a long time. It's really difficult, he's part of the family too. So, it's a tough conversation, but I say education.
Yeah, before you
Right.
need it.
Right.
There's no reason you can't go look at a community like mine, or maybe one that's closer to you. And the reason I say that is because at some point, I know I've done it to my kids, and you're not gonna put me there, you're not gonna put me there. But you know what, they remember that. And I can't tell you the number of sons and daughters that sit before me, and their mom and their dad are failing in their home. They're literally, I had a family where they were crawling up the stairs to get to the bathroom. But the kids kept them at home because they made that promise. And then they fell. And then it went from home to Lynn to me. So it's worth looking at it before you need it, before the situation is emergent, because times have changed when it was just, a long-term care community. Go see that. So that way you can say, you know what, I kind of like that. That wouldn't be bad. And I always recommend that, because we do remember, as children, I remember what my mother said, and I know what she would want. And I think about my grandmother, and what we have now today is so different from then. So it's nice to take a look, to be prepared before it happens, and maybe you'll never come to a community like mine, but at least you know what's out there.
Right. Options. And you get to have lunch.
And you get to have lunch, and if you come at 3, you can have some wine or a beer, and on
That's
Tuesdays
right,
it's
have happy
specialty
hour.
drinks. It's rum and Coke today.
Shrewsbury Nursing Home, I'll tell a funny story. We have an outpatient physical therapy and occupational therapy and speech outpatient clinic on the campus of our nursing center. And we were doing a presentation over at Orchard Grove a couple of weeks ago with our rehab team, and she goes, perfect time, we're gonna do it right before happy hour, because we get all the people that come down for happy hour. So we were, doing like a balance, we did a rehab on balance, and we're like, so have you had those 2 wines? And then you're gonna
Right.
get up.
That is pretty
So,
good. Yeah.
but again, just, be an advocate for yourself, or designate a loved one that can be an advocate for you. Look at all your options, talk about, it's not something that you wanna talk about over Easter dinner. But, all of a sudden life changes, you end up in the hospital, your loved one ends up in the hospital, they're in a coma, or you've gotta make a decision which way we're gonna go. Or, your loved one's been in the hospital for a couple days, and you're hearing all this information, your head is just gonna explode, and all of a sudden the case manager says, we spoke about this, your loved one's being discharged on Friday. What are the plans? And you go, Friday? What, it's
tomorrow.
Thursday, what do you
Right.
mean? You didn't tell me that. And they like, no, we had the conversation with you on Monday, but you didn't hear it. And all of a sudden you're in a panic mode, and we have all gotten those calls at 4 o'clock on a Friday afternoon going, what do we do? Where do we go? What's our decisions? What can we do? So, plan ahead. We just, keep on reinforcing that, but we see it every day. So really, it's so important to plan ahead. And again, we live in a state with so many options. We have we have some of the best hospitals in the world. And we're lucky that we have St. Bede's and UMass in this area, Milford down the street. We have great options. We're not somewhere in the Midwest where we're driving 3 hours to go to an ER. We have a lot of walk-in clinics, we have a lot of options. So again, be advocates for yourself. And just to recap, we have the PACE program, which is a national program. Fallon Summit actually manages it in this marketplace. I don't know if there's anything else you want to add to in recapping in the Summit program at all.
Just again, to note that we provide all-inclusive care, and certainly I have lots of materials here, so I have my contact information. So if you're interested, or if you have a family member or a friend, certainly feel free, and I'm available for any questions too.
And then we have options in home care. So you have private home care, which is accessible, which is what I represent, and we come in and we can help you with your activities of daily living, so your dressing, your showering, your meals, light meal preparation, light housekeeping, driving you to follow-up physician's offices or going to the grocery store. All those are done under home care, and that's, private pay. And then you have the V&A, which is paid for by insurances, or otherwise known as certified home care agencies. And then you have nursing centers that are known as nursing homes, rehab centers, short-term, long-term, memory. They're all a nursing home. That's how we're licensed. But you have options again, and to look at, as I said, and I think Melissa even said too, pick 3, go to 3, choose your area. If you want to stay in this area, you've got a lot in this marketplace to look at. But in a nursing home, look at what their last state survey was. Look at their star rating. Again, 5 stars is the best, 1 is not, which you would think it would be the opposite, right? So, look and plan ahead and see what, when that decision has to be made, because unfortunately it will happen. My mom is 95 years old with advanced Alzheimer's. She's in a memory unit in a nursing center. And my father, after, they've been together, I think 71 years this May will be their anniversary. And he said, I will always take care of her. And we ran. We looked at the PACE program. We did the home care. She went into a nursing center, short-term, which converted into long-term care. And he said, oh, I will never put her in a nursing center, but it got too much as a caretaker. And my dad is in his 90s, my mom is in her 90s, so there's a safety issue that was going to happen with either one. And I, wouldn't be able to run to the nursing home, run to the hospital, and back and forth. They haven't cloned me yet, so we had to make the decision that, her care, her safety is important, as well as my dad's care and safety was important. So, and he goes there every day to visit her. So, it makes a difference. And then you have great, options regarding different assisted livings in this area. There's how many now in the state? Do you know a couple?
There's quite a few. So there are quite a few for enhanced independent assisted and memory cares. And like I say, you visit 3. We're all going to say, we have 4 apartments, we can do this, but you want to visit 3. And when you walk out with innocent families, you should be like, wow, I could see myself there when the time comes. I really liked it there. The people were so friendly. It's clean. The food was phenomenal. They have happy hour. Whatever is going to float your boat. Everybody, it's going to resonate differently to different people. So that's why I say take a look. So we are not about just when you need physical support. We're about when you're lonely, you're isolated, you're not driving anymore. And then we have that continuum when you do need some help. So that's what we're about. We try to make the tough stuff easier. So.
And then the other option again, hospice, it's been around for what, since it started in England, how many years ago?
Well, it started in England, like in the 1800s, but it really only came, in 1976 was when the first hospice house was created in America. But that's why I think there's so much misinformation, some myths and some facts that have stayed with us through the generations, because in the 70s, it was really a way for people to say, like, okay, wait a minute, like, it was mostly people in the hospital who had cancer. There was no longer any more treatments. How do we get morphine to the house to keep them comfortable? Well, how are we going to do that? And so hospice, right, kind of, that was a lot of what came into play. But it has just changed so much over the years. And Medicare, the Centers for Medicare and Medicaid, it's very heavily regulated. The only thing that I think is unfortunate is it has really shifted to a lot more, just like the nursing homes, corporate, out of New Jersey, New York. They buy them up and they're out there. Your local nonprofit organizations will always have a lot more investment in their communities. It's just, there's just no way around it. But in this country, it has flip-flopped. It used to be 70% were nonprofits, mostly tied to either religious organizations. There was a few government-run, and then very minimal for-profit. Now there's probably less than 20% nonprofits in the industry. And so it's switched. So that's why I say, buyer beware. I mean, do your homework if you can. Most people are in crisis. They don't get to do their homework, unfortunately. And I'd like to just also just really quickly, Lynn's story is the way you want that to go. Calm heads, making calm, solid decisions. Okay? I personally have just been through 2 months of unbelievable bad, let's see, bad decision. But I had a family caregiving, mom with Alzheimer's, you know, and did the best job ever taking care of mom. I mean, the best. And it was that thing about never going to put her in a nursing home. We're not doing that. We're not doing that. The decision was taken out of our hands because there was a fall, you know, and this is, you're going to hear this, it's a theme. A fall, an infection, a pneumonia, what have you. You're in the hospital, now you have to go to a rehab. Well, guess what? You're at the mercy of who's got a bed, right? So you go where they put you sometimes. You say choice is great, but if there's no beds, you got to go where they go. So, you know, we're there, we're like, oh my God, this isn't good, you know, and because she had Alzheimer's, really wasn't a lot of rehab because she was not going to get, there was not much they could do to make things that much better. So Medicare didn't cover a long stay. We didn't get to worry about the 21 days and all of that. It was like, you know, oh, that's it. You know, now she's private pay, you got to pay for the bed or take her home. And, you know, we had just applied for Medicaid, so there was like no money. And now again, who's going to take her? We cannot take her back home. It's unsafe. We've learned now the hard way that it's not fair to her. And she's lucky she's got all of us kids, you know, pitching in and helping, and we wanted her, you know, to have her best life, but we didn't get to make a decision. We got really, really lucky. Somebody really awesome took us. It's in another state. So, yeah, I think he was watching out for her. She said her rosaries a lot. But I mean, there you go. I'm in the industry, and we still missed the boat. You know, we're still reeling from all of this, these decisions that had to be made on the fly. And we're just now starting to process and come down and see how the new normal will be. And so you gotta forgive yourself and your family though, if they don't wanna have this conversation with you. You may have to advocate while you can on your own. You know, your kids may say, I don't wanna hear it, I don't wanna hear it. You're not going anywhere, I'm never gonna let that happen to you. So my kids say, I'm like, no, please, don't.
And until you have to give a loved one, your mother or father, a bath.
Yeah, no.
Or toilet them, and then all of a sudden they go, oh my God, I can't do this, you know?
Or
We're in the industry,
or
and
would
it's hard
you-
enough for us to do it.
Or would you want
Right.
your kids to do that? And that's the thing. Yes, sacrificing, we have to take care of our family is important. But give yourself the room for forgiveness and give your families the room for forgiveness. And understand we're all just trying to figure it out, even when we think we know what we're talking about. So you know.
And in closing, I just wanted to let you know there's some yellow flyers over there, and I know Michelle will be putting this up, but for those veterans and also for spouses of veterans, there's called the program Aid and Attendance, and we actually have Major, he actually really is a major, that's not his first name, that's his title. Major Jones will be presenting here, and we're going to be doing a program on Tuesday, May 9th, 12:30 to 1:30. And an aid and attendance helps pays for sometimes assisted living, sometimes home care, and there's funds, and there's a huge criteria that has to be met, but, you know, and you have to serve in a wartime and everything else and have an honorable discharge, but it also can be for the spouse too, it's not just for the veteran, so.
He's very informative.
Yeah, so
gentleman.
he's gonna be speaking here. So if you're interested, there's some flyers over there, and I know Michelle will be getting more flyers. Questions that any of you have for us while we're here? Hi, group. Thank you. Thank you. You know, it was educational and informative, and pick up these pieces, you know, you might put them aside and put them on your coffee table, but they'll be helpful for all our brochures. Thank you so much, we appreciate your time.